We are now delighted to have one more talk before lunch and would like to please welcome Mary Durham, Vice President Research in Kaiser Permanente, integrating prevention measures in a healthcare system. Why and how? Welcome.
Thank you. Thank you very much, and I couldn't have had a better welcome from the last discussion that we had about how companies that are healthcare providers can actually use technology to solve some of these very vexing questions for the elderly and for our entire populations. And so I've been asked to talk a little bit about Kaiser as an organization, and I wanted to do this by starting first and telling you a bit about what our vision and our goal is for Kaiser Permanente, and it's to provide high-quality, affordable health care and to improve the health of our members and the communities we serve. And so not only are we providing care in the United States, and I'll give you a bit about the numbers that we're using, but also our goal is to make this affordable, reachable for people who are working people, for other people across the United States. Just a moment about who Kaiser Permanente is. I know some of you have actually visited Kaiser Permanente and perhaps heard about the company, but I wanted to tell you this because it strikingly resembles the population of Sweden. We have 7 regions serving 8 states in the District of Columbia. Right now we have about 9.5 million members across the U.S. We have 17,000 approximately physicians and 175,000 employees, about 50,000 nurses. We have 37 hospitals and counting, still building hospitals, and we co-locate those with our medical offices. And we now have about 618 medical offices and other outpatient facilities. And here you see a distribution. We're heavily weighted on the west coast of the United States. That was our birthplace. And so we're still heavily located in California, in Oregon, and Washington, but we're also well represented on the East Coast and just a little bit in the middle of the U.S. And hold on to this notion because I'll come back to it in just a second. But in the U.S., by dint of history, much of our health insurance comes through our actual employers. This is changing a bit. It will be changing pretty dramatically, I think, over the next 20 years. But right now, you can see that we're mostly, the insurance is actually paid for or shared by people who are employed and then by their employer, with a chunk of this for Kaiser Permanente, about 18, I'd say 20% right now as Medicare and Medicaid, and then only 5% of individuals. Although I know that you're hearing probably a bit about Obamacare, and healthcare reform in the U.S., and so we'll expect to see more of that individual slice growing. But for right now, I think this is a pretty good picture of the United States. Now, I wanted to tell you about Kaiser Permanente's journey, and I think it's truly should be said that this is a journey over the 68 years that we have been in business, because we have gone from the paper and pencil world of encouraging people to come and get preventive care and to some very interesting and I think quite path-finding approaches that I'll have a chance to get to a little later this morning. But there are 4 what I call pillars to this journey on prevention. And we believe that all 4 of these elements are absolutely essential to make the most of preventive care and incent everyone, whether it's a patient, the provider, the employer, whomever is associated with our healthcare experience, to really put full value in prevention. And I'm going to go over these each in turn, but they are prepayment, which people here should be familiar with. That is the amount that is paid for for the care provided in a given year, let's say, is paid in advance fully, so that then the healthcare organization is responsible for all the services that are provided. In integrated group practice, we'll come back to that, population-based approach, and advanced information technology, which I think you'll find will blend pretty easily into what Mitch was just talking about. But prepayment is in the DNA of Kaiser Permanente. And this is because of the two men that you see here. Sidney Garfield, who was a surgeon and a visionary, a trailblazer, who wanted to develop a prepaid system of care, but even more so, Henry J. Kaiser, who was an industrialist of all things. He was building ships, he was building automobiles, he was building cement factories and steel during World War II. And he wanted Sidney Garfield to provide services to his workers in the shipyards. And he wanted to do it for a few dollars on a monthly basis, that the Permanente Medical Group would take care of that employee and his or her family for all of their medical needs for that certain cost on a yearly or a monthly basis. And so that was the first notion of prepayment. And believe me, this was a radical idea in the United States, so much so that many of our physicians were barred from practice in other hospitals because we were thought to be so different and strange and politically off base that they weren't invited to practice locally. Part of the reason that we developed our own hospitals. Integrated group practice is another aspect of what we believe is the magic sauce for promoting promotion, health promotion and prevention. And that is to include all of the pieces that are necessary for taking care of one into care. I'm recalling my mother, who was in hospital for cardiovascular disease toward the end of her life, and she was not in a Kaiser Permanente. She did not live in an area of the U.S. where such an organization existed, and so she would go to her primary care doctor, who would refer her to the cardiologist, who never knew what medications were being prescribed by their primary care doctor. She had a fall and she went to an orthopod who didn't have any idea of what was happening with her cardiologist, and so it goes. And so no one was able at all to coordinate her medications except for me, and I learned the biggest lessons about healthcare during that experience. But nevertheless, we pride ourselves on being in a group practice so that the audiologist knows what the behavioral medicine person is doing, who knows what home health care is doing, who actually is very much tied into physical therapy. And so this is a model where that information slippage, and I think you were talking about this before, doesn't get lost. And this is a very fundamental part of how to do prevention, I think, well. What you're looking at here is a tool that's been developed that supports our population-based health approach. As a primary care physician, I look at what we're calling here the panel support tool. I can pull up on it all of the women in my practice. Say, as a primary care doctor, I have 1,500 people in my panel. I can pull up all the women in a certain age categories who have not had a mammogram or a pap smear. I can find women who have a history of gestational diabetes and make sure that they've recently had a hemoglobin A1C. I can find men who have a history of smoking who are over the age of 65 to monitor them for AAA. I am obligated to look at my panel to see how my panel is doing on all the health prevention measures that are valued and incented, from the CEO of the organization to people on the front lines of care, so that part of their reimbursement, their pay, is actually structured on how well they provide preventive services. That puts teeth and incentive where it's required to be done. Also, and this is what's so much fun about this, this work is our commitment in Kaiser Permanente is really to harness technology and our data assets to enable the best tools and care innovations. And we are committed to leading the industry in technology-enabled and data-supported healthcare. And I'm going to show you a bit about this. We've created systems that I think are very impressive and do many of the things that we're talking about in keeping track for you, allowing you access to that information. But I want to say something before I kind of provide a blizzard that where you think you can't accomplish this. We started our journey this being the fourth pillar in that whole complex of the things that I think are necessary for prevention as a journey 68 years ago. We began this with paper forms. We began this, our next generation, for example, being calling people on the telephone. We followed that up with interactive voice recognition, which is a very inexpensive way to reach out to people to say, you're overdue for a mammogram, you need to come in for a pap smear. So that inexpensive technologies that can be contracted by companies that do this for a living and do it very inexpensively can reach out to people no matter where they are, as long as they have either a landline or certainly a cell phone, so that those kinds of things can be accomplished. And I have data that I won't share with you right now, but I have certainly available for you about how successful that has been, because people tend to have telephone communications where you can reach out to them, and calling them and making contact really does increase the likelihood that they will follow up. But let me show you. We're now becoming familiar with the fact that people have electronic medical records, but I found this very interesting because electronic medical records now, as you can see, in the UK, a penetration of 97%, in the Netherlands, 98%, in Norway, 98%, in the US, a kind of a paltry 69%. But I'd like to focus your eyes on the multifunctional health IT capacity, because this is something else. And this is what I want to talk to you today about with the pathway that Kaiser Permanente has followed. We have created the killer app, I guess you would say, which is called Health Connect. And it's more than an electronic medical record. It's that red bar, not the blue bar that you saw in the previous slide. It's a system that crosses all of our facilities in every aspect of our lives, our business world, that integrates the clinical records with appointments. Do you want an appointment? You go online to KP Health Connect, and I'll show it to you in a minute, so that you can make that appointment right there. You can get ancillary and specialty services, registration. There's information on billing, so our business systems are linked to our clinical systems. We have more than 4 million of our members, we're coming up on half of our members who have gone on to establish an internet access. And they have now gotten on to Health Connect so that they're actually in real time being able to look at their medical records and other aspects that I want to show you in just a minute. But I wanted to say that Kaiser Permanente typically spends about 5% of our total on information technology. That is not out of line with the banking industry or other kinds of industries on their technological supports for the businesses that they're conducting. And so in this way, we've built this integrated healthcare system for care delivery. It had a very big price tag, but we estimated the return on investment was achieved in about 8.5 years. And you'll see in just a moment some of the payoffs that we're getting in terms of adherence or compliance with treatment recommendations and other things that come from it. So this is kind of a busy slide, but I wanted you to see the inputs and the outputs of the information system. It's highly coordinated by looking on the left-hand side. You see just some of the inputs, and actually this looks like a slide that we saw a little bit earlier. And you can see that we have lab tests, we have imaging, radiology results, we have pharmacy, we have immunizations, and so forth. All of that information about you goes into KP Health Connect. And this is a secure web-based product that allows you to log on and have secure communication with your doctor. You can send your doctor messages. Your doctor will send messages back to you. You can make appointments. It's in real time. It's 24/7. It's linked to the delivery system. Clinicians are putting data into it. You are putting information into it. And then all the other systems are putting information in. And it comes out on the bottom part with more detail to come on kp.org or My Health Manager. But interestingly for us today, many of the things that we've talked about, like disease registries, risk stratification, patient management tools, In-reach and outreach, I'll give you a couple of examples, and monitoring and improvement measures and reports. All of this come and are all connected together. And so let me give you an example of the outreach, letters and automated telephone outreach. Actually, I gave you one of the interactive voice recognition, where we can generate lists of individuals who have not had colon cancer screening, or people over the age of 65 who've not had a hemoglobin A1C in the past 5 years. And so instead of just waiting for those individuals to come to see us, we are merciless. We call people, we leave messages. We've seen that leaving messages in colon cancer screening to get people to take the fecal occult blood tests. If we call them and leave them a couple of messages and they actually hear those messages, they are 3 times more likely to order the FOBT and actually have the test done. And so we know that these are powerful ways to make positive contact with our members. We also have in-reach prompts and reminders for clinicians. I'm reminded in Oregon, in one of our regions, we just did an analysis to find people who had a hemoglobin A1C over 8. And so they were diabetics, and they had not had a screen hemoglobin A1C in 5 years. And so we made contact with them, we offered them appointments, we brought them in so that they met with a diabetes nurse. We had to re-screen them 61 days later, and so we brought them back in after 61 days to measure their hemoglobin A1C. And so we're actually not waiting for the opportunity to see them, but rather to make sure not only that we ask them to be screened, but that we prompt them nicely, but diligently to come and take care of all of those issues. And in fact, I would say that nowadays, one of the watchwords in Kaiser Permanente is care gaps, because we have lists and lists and algorithms of things that each of us as patients need to have. And one of the things that's very clever, this is my birthday month. And so because it's my birthday month, I know that probably when I get home in the mail, I will have a birthday letter. And in that birthday letter, it will tell me exactly the things that I should have for my screening in the next few weeks. And we've seen a 10% increase in the follow-up for those screenings because of that birthday letter. It was a postage stamp. And so it really shows the power of inexpensive methods for contacting people and asking them to take action. This is a screenshot of what, when I log on to kp.org, I see. And what I see here is a list of the immunizations. If you looked a little more closely, you could see test results are on there for me to read. In my immunizations, allergies, the list of drugs that I take. I can order refills, and they will appear in my mailbox in about 3 to 5 business days. Usually it's 2 to 3, but we promise 3 to 5. My complete health assessment, a personal health assessment that I have done online and now resides there for my doctor to see if I want her to see it. It gives the secure messaging to my doctor that I mentioned before. I can schedule appointments and so forth. And so it's really a one-stop place to see all the things that have to do with my health care. And we've gone mobile. And so all of the things that I just showed you that can be done online can now be done through a handheld. And seniors, we said, no, seniors will not use this because they don't have handheld, they don't have mobile devices and so forth. But indeed, they're some of our highest online users. And this use of these secure messaging has led to improvements in glycemic and cholesterol and blood pressure screening, and better adherence with medication, and it has transformed primary care. You can see on the far left that in 2003, 95% of our patient encounters were office visits, and look how that's changed by the first quarter of 2013. So that we are doing more and more of our visits through secure email and telephone and other means. I wanted to just say one last thing about the next frontier. If this is a journey, Kaiser Permanente is now taking another journey that is relevant to our discussion here. You know that medical care is really a small percentage of health, of the drivers for health. Much of it is the environmental and social factors. This is old news, personal behaviors, family history, and genes. But so what we are, our next frontier is total health. And you're going to hear more about this from Kaiser Permanente. And that is, we want to maximize total health, the World Health Organization's definition, using mind, body, and spirit. And we have this kind of complicated but very comprehensive model that shows the investments that we're going to make in those areas that relate to personal behavior, to genes in the environment, to farmers' markets, to the things that matter in individual communities to be able to achieve physical and mental health improvements. And so we know that this is going to be very challenging, but we're well on our way. This is quite, an experiment for us, but we are very excited about it, and we'll tell you more about it next time.
Thank you very much, Mary. For those who are really curious to get more of the juicy details with the economy and with different aspects of the strategies, can they talk to you? Will you stay here?
Oh, yes, I'll be here all day tomorrow as well.
Perfect. So you know whom to brain pick there. You had a question too, Richard?
I did. Thank you, Mary. Very valuable explanation of how Kaiser works. But what came to mind for me is the managerial side. How do you're describing a tremendous amount of collaboration, cooperation amongst teams, medical professionals, in many cases highly trained staff. How do you motivate your employees to do this? And do you pay them based on performance, based on outcome? Do they have a financial as well as a good-hearted professional motive in this?
From the Chief Executive Officer, Bernard Tyson, to every person in the organization, organized labor, professionals, our research community, I head our research community, all of us have part of our pay pointed toward the accomplishment of these objectives.
So it's tied, part of your pay is
Yes.
actually tied to achieving certain outcomes and goals.
Yes. Our CEO is accountable to the board, and so his compensation is tied to meeting those goals. And as well as our physicians, who are a physician group. They're not our employees, but we negotiate those contracts each year. We have exclusive arrangements with those physicians, and their pay is also tied to accomplishing these. Now, not all of them are in the prevention space. They may be in diabetes care,
Right, sure.
diabetes itself, and so forth, but all of them are
All right,
really
so the point
tied.
is that your management and your employee payment strategy is integrated into
exactly
your
right.
health provision strategy. They are linked.
That's
they
right.
are not separate territory.
That's right. And we're managing against the capitated rate, not a fee for service.
That's true.
And
You're
so-
managing against a fixed level, but that's a lot like taxes, which is fixed. So you're managing against a fixed pot of
That's
money.
right. And that's why affordability is one of our, and that's why I started with our vision, and that is to make healthcare more affordable, which comes from our roots in the shipyards.
Well, and that also explains why you're looking to cheap technology as much as to expensive technology.
Yes, that's right. And
Okay.
we have a huge amount of work that's going on in video and web-based technologies that will support people in their homes, so that, as you saw, the transformation of primary care away from the office, some of that's being done face-to-face on Skype, some of it's being done on telephone, some of it's being done electronically through secure messaging, etc.
We do hope that you will discuss during the lunch break, just in a second, how you could implement any of these ideas or structures in your very everyday work, because maybe there is a copy-paste possibility for part of the thinking that's been done throughout the 68 years. And we would like to very warmly thank you, Mary, for the insight.